All right, we discussed about the hypertension definition and the classification of the hypertension, blood pressure regulation, and pathophysiology of this. Let's talk about the major risk factors. There are two different type of factors that will influence on the patient blood pressure. Modifiable risk factors and non-modifiable risk factors. Non-modifiable are smoking, obesity, alcohol intake, high dietary intake of fat and sodium, sedentary lifestyle, stress, and diabetes mellitus. Thinking about these modifiable risk factors and your role as a nurse, what do you think? Can you help the patient to manage a hypertension with these modifiable risk factors? What is your role in here? Huh? Yeah, that's correct. Educating the patient. Educating the patient about all these factors and about the health maintenance and preventive measures. You play a huge role in patients' lifestyle. Yeah, let's talk about the non-modifiable risk factors: age, gender, heredity, and ethnicity. Can we change it? No, of course. So all these factors plus the medication, one of the medication that puts the patient at risk for hypertension is hormonal contraceptives. We need to be aware of that and make sure when you assess your patient and it's a female in a age that they could take this type of medication, ask the patient about the medication that they're taking or the contraceptive measures they're taking to prevent from the pregnancy. So be aware of your role and help your patient. Okay, I put some case study in here, one or two or three case study, and I really recommend you guys to take time after reading the case study, answer to the questions. Case study one is Mr. Johnson or Carl Johnson, a 42-year-old African American male. He has an appointment with his family doctor for a physical that is a requirement of his new job as a soccer coach. Carl has never had any health problem, smokes 1 pack of cigarettes a day, and drinks approximately a 6-pack of beer per week. He was in a physician's office 2 months ago for a cold. His blood pressure reading at that time was 168/92. Okay, what type of blood pressure is that, or hypertension is this? Think about it. Let's go. He was instructed to lose weight, stop smoking, and control his alcohol intake. At that time, he was scheduled for an appointment 3 months later to have his blood pressure rechecked. His brother, age 54, has been taking medication for 10 years for primary hypertension. So think about his condition and factors. How many modifiable and how many non-modifiable factors is including in this case? Let's go. You are the nurse taking his vital signs, which reveal the following results: a temperature of 98.4 Fahrenheit, pulse 86, and it is regular, a respiration of 22, a blood pressure of 174 systolic over 94 diastolic, weight 225 pounds, and height 5 feet and 10 inches. Carl is not taking any prescribed or over-the-counter medications at the present time. He states, I feel pretty good. No problem. All right, let's see. Question 1. Based on Mr. Johnson's history, vital signs can, vital signs, can you identify the modifiable and non-modifiable risk factors for essential or primary hypertension? All right, take your time, stop the clip, and write your answers. It's easy. I know you can do it. So what to look for? As I mentioned before, hypertension usually doesn't produce signs and symptoms until a vascular changes in the heart, brain, or kidney occur. Severely elevated blood pressure damages the intima of small vessels. Hopefully you guys know what is intima, and resulting in fibrin accumulation in the vessels, local edema, and possibly intravascular clotting, sorry, not clotting, sorry. All right, signs and symptoms may include blood pressure measurements of more than 140, systolic over 90 diastolic, on 2 or more readings taken at 2 or more visits after an initial screening. A throbbing occipital headache upon waking, drowsiness, confusion, vision problem, nausea. Expect a patient with secondary hypertension to have clinical manifestation of the primary disease. Other clinical effects don't appear until complications develop as a result of vascular changes in target organ. So these effects include left ventricular hypertrophy, angina, myocardial infarction, heart failure, stroke, transient ischemic attack, and nephropathy, peripheral arterial disease, and retinopathy. Okay, so self-assessment. See how much you know now. How much have you learned? The factors leading to primary and secondary hypertension are different. Can you identify the causes associated with each of the two types of hypertension? All right, write your answer. If you don't know, even discuss it in discussion board or come and see me in my office. All right, patient assessment. How should I assess a patient with the history of or with the newly diagnosed patient with hypertension? A thorough health history and physical examination are absolute necessary in here. So be very cautious about the history and physical examination. Think about the factors, risk factors, and do your assessment. Think about all the modifiable and non-modifiable risk factors while you're doing your history and physical examination. There are tests, laboratory tests that could be done to rule out what? So when along with patient history, the following test may show predisposing factors and help to identify what? Help to identify the underlying causes. So what urinalysis tells us? Protein, red blood cells, and white blood cells in urine may indicate what type of disease? Think about it. Yes, glomerulonephritis. Blood chemistry and especially blood glucose. Elevated blood glucose level may indicate of, yeah, you got it, diabetes. So patient with diabetes can develop hypertension, right? So we talked about the risk factors. Here is the same, but to rule out that, we need to do some tests. A complete blood count shows anemia, which may cause high output states resulting in hypertension. Polycythemia 1 increases the risk of hypertension and stroke. A lipid profile, cholesterol levels or lipid profile, elevated total cholesterol and low density lipoprotein levels increase the risk of atherosclerosis, which finally cause the hypertension. What else we need to do? The serum potassium level on blood chemistry, a level less than 3.5 milliequivalent per liter may indicate adrenal dysfunction, which is a primary hyperaldosteronism. A BUN and creatinine level also included in blood chemistry, which a normal or elevated to more than 1.5 milligram per deciliter suggest a renal disease. And other tests that can help us to detect cardiovascular damages is an ECG. All right. Question number 2 related to our case study number 1. The physician will perform and order some diagnostic studies before starting treatment for Mr. Johnson. Can you identify the rationale for these studies? So the studies are ECG, urinalysis, and complete blood count, and a metabolic panel including a BUN creatinine and glucose level. Take your time, you write your answer. My time is over about this clip. I will talk to you in the clip number 3. All right, take your time, write down your answer to all the questions.